Erectile dysfunction isn't just about sex. 14% of men who get ED early will have a heart attack within 7 years. If you love your manhood, or at least want it to keep working properly, this one's for you. I'm Dr. Max, urologist and men's health expert. I've spent over a decade helping guys boost their energy, their confidence, and their erections. Today, we're breaking down 10 things you should never do to your penis. These mistakes aren't just embarrassing, they're dangerous. Trust me, I've seen it all. My job is literally to help guys fix problems down there: pain, performance, infections, and yes, the dumb stuff we do to ourselves. And here's the deal. Some of the most common mistakes are completely avoidable. You just have to know about them. Stick around till number 10, because it's the one thing every man ignores, and it can sneakily wreck your sex life. And before we dive in, if you've seen my content before and you like having a doctor who actually talks like a real person, hit subscribe. Only 20% of you are subscribed, and if that number doesn't go up, my editor is going to start charging me per penis joke. I'll never forget one guy, 42 years old, regular job, 2 kids, seemed healthy. He came to see me only because his wife begged him. He'd been dealing with mild ED for almost 5 years. He kept blaming it on stress from work, raising kids, not getting enough sleep. Sound familiar? But something felt off, so we dug deeper. Ran some blood work, stress tests, and boom. Early stage coronary artery disease. He had no chest pain, no shortness of breath, just a penis that wasn't cooperating. We caught it in time. He got on medication, cleaned up his diet, started exercising. And here's the crazy part, 3 months later, his erections came back too. That's the part guys don't realize. Your penis is often the first organ to throw up a red flag. You ignore it, you're not just risking your sex life. You could be ignoring a warning shot from your heart. So next time something feels off down there, don't brush it off. Don't tell yourself, it's just stress. It might be, but it might also be something way more serious. Listen to your body. First, don't ignore your penis. Let me say this loud and clear. If your penis is acting up, something deeper is going on. Can't get hard? Numbness? Shrinkage? That's not just bad luck or a rough week. That's your body waving a giant red flag. We've known this for years. ED is often the first symptom of bigger health problems. In fact, for many guys, erectile dysfunction shows up before they ever get diagnosed with heart disease, low testosterone, or even diabetes. Why? Because your penis needs perfect blood flow, healthy nerves, balanced hormones, and a calm mind to work right. One hiccup in that system, and boom, it shows up down there. I always compare it to your car. Imagine you go to start it in the morning, and it cranks for 10 seconds before sputtering to life. Then the next day, nothing. Would you just cross your fingers and hope it works tomorrow? Of course not. You take it to a mechanic before it breaks down for good. Well, your penis is the same. If it's not working consistently, if you're starting to feel anxious about, will it work tonight? That's not something to ignore. It's something to investigate. Think back, have you ever had a moment where things just didn't fire properly? Maybe it was once and you blamed it on stress or too much to drink. But what if it wasn't random? What if it was your early warning sign? Your penis isn't just about pleasure, it's about performance and protection. It could literally save your life if you pay attention to it. So don't wait till it's too late. 2. Don't DIY penis hacks. I get it, guys want results yesterday. Bigger, stronger, longer lasting. So they hit the forums, the sketchy websites, or TikTok, and suddenly they're pouring apple cider vinegar on themselves, stuffing their junk into bottles, or yanking it like they're trying to win a carnival prize. Look, you're not MacGyver. You're not biohacking. You're one bad idea away from permanent damage and a very awkward trip to the ER. I had a guy once use a rubber gasket from a hardware store as a homemade constriction ring. It got stuck. His penis swelled up like a purple cucumber, and we needed the fire department and a bone saw to get it off. No joke. Another guy tried vacuuming his penis using a modified shop vac. Why? Because some online coach said it would increase size. Instead, it nearly degloved the poor guy. And joking? That's the DIY king of bad penis ideas. It involves squeezing and pulling the penis aggressively to stretch it out. What it actually does is cause microtears, tiny internal injuries that, over time, can lead to scar tissue and erectile dysfunction. You want stronger erections, not scarred ones. Here's the rule. If it sounds like it belongs in a medieval torture manual or a Reddit thread titled, "Don't try this," you shouldn't do it. Penis health is not the time for YouTube life hacks. Talk to a urologist. We've trained for over a decade, so you don't have to test the limits of household objects on your genitals. And I gotta ask, what's the dumbest thing you've heard someone try to boost performance? Drop it in the comments. I could fill a whole episode just on those stories, and yes, names will be changed to protect the guilty. 3. Keep it clean. Gently. Let's clear something up. Under the foreskin is not a self-cleaning oven. It's not going to sparkle on its own. If you're uncircumcised, you need to pull it back. Wash with warm water and mild soap. Rinse thoroughly and dry gently. Every day. No excuses. But here's the key, don't go full power washer mode. This isn't your barbecue grill. I've had guys come in with red, irritated skin, or even tiny cuts, just because they scrubbed too hard with rough cloths or harsh soaps. The skin down there is delicate. It's full of sensitive nerve endings, and using strong body wash or anything with heavy fragrance can leave you with rashes, itching, or worse, balanitis, which is basically inflammation of the head or foreskin. It's uncomfortable, embarrassing, and completely preventable. And if you notice a white, cheesy buildup, that's smegma. Totally normal, but it does need to be cleaned off. If you let it build up, it can lead to odor, infections, and even an increased risk of penile cancer over time. Quick side note, if you can't pull your foreskin back, or it hurts when you do, that's something we should talk about. It could be a condition called phimosis, and there are ways to treat it without surgery in many cases. Bottom line, clean it like you care about it. Mild soap, warm water, gentle hands. Treat your penis like it's the VIP guest of your body because, let's be honest, it kind of is. 4. Don't ignore pain, bumps, or blood. Let me put it plainly, if something feels off down there, don't play the waiting game. Pain, burning when you pee, sores, bumps, blood, these aren't things to keep an eye on. These are signs, alarms, and they're not going away on their own. I've seen men wait too long, months, even years, because they were embarrassed. And by the time they finally come in, it's gone from treatable infection to partial amputation. Yeah, that real. I had a guy once who ignored a painful ulcer because he thought it was a rash. Turned out to be penile cancer. He lost half his penis because he waited. And here's the kicker, most of these things are totally treatable when caught early. A simple cream, a quick antibiotic, maybe a minor procedure. But the longer you wait, the fewer options we have. Look, I know it's awkward. I know it's vulnerable. But I'm a urologist. I look at penises all day. This is literally my job. You're not going to shock me. Whatever you've got going on, I've seen worse. Much worse. There's zero shame in getting checked out. But there's a whole lot of regret in pretending it's not happening. So here's your rule of thumb. If you wouldn't ignore that same symptom on your face, don't ignore it on your penis. If you saw blood coming out of your nose for no reason, would you just wait and see? No. So don't do it here either. Take care of your health. Protect your future self. Just come in. We've got you. 5. Safe sex means better sex. Let's kill the myth right now. Being safe does not kill the vibe. In fact, it makes everything better. When you know your partner's status, when you're using protection, when you've got lube on hand, you're not worrying about accidents or infections. You're free to be in the moment. That's what makes sex amazing. Stress kills erections. Anxiety about STIs or unplanned pregnancy kills desire. But when you're protected, informed, and confident, you can let go. You can be playful, curious, fully present. And yes, lube is your friend. Not because anything is wrong, but because it makes things smoother, more pleasurable, and safer. Less friction means less chance of tearing skin or causing irritation. Plus, the right lube can seriously level up sensation for both of you. It's not a backup plan, it's an upgrade. And here's something no one says out loud. Experimenting with different types of condoms and lubricants together can actually be fun. It opens a conversation about what feels good, what works, what you both like. So no, safety doesn't kill the mood. It builds trust. It removes pressure. And it creates space for some of the best sex of your life. Don't believe me? Try it. 6. Don't cook your balls. Sounds funny, but I'm dead serious. Your testicles are heat-sensitive little factories, and they hate being too warm. Why do you think they hang outside your body in the first place? It's not for aesthetics. It's because sperm production needs a temperature slightly cooler than the rest of you. Even small increases in temperature, like a couple degrees, can slow down or screw up the entire process. Now here's where it gets real. I've seen tons of guys with fertility issues, low sperm count, low motility, hormonal imbalances, and when we dig into their habits. Saunas every week. Hot tubs on the regular. Laptops roasting their groin for hours. Or the worst offender, phones in the front pocket all day long. All of that adds heat directly to the scrotum. And over time, that heat messes with sperm quality, testosterone production, and even testicular health overall. So what should you do? Limit hot tubs and saunas. Save them for special occasions. Use a lap desk or cushion if you work with your laptop on the couch. Put your phone in your jacket or back pocket, not pressed up against your boys. And skip tight underwear if you're trying to optimize sperm. Go breathable, go loose, give your guys some airflow. Bottom line, if your balls feel like they're sitting in a microwave, it's time to cool it, literally. Treat them like the high-performance equipment they are. Because they are. 7. Be nice when you're solo. Let's talk about something no one teaches young men, how to masturbate without messing up your sex life. If your grip during solo time could crack walnuts or crush a stress ball into dust, yeah, we've got a problem. That kind of super tight grip is what we call death grip. And here's the issue, it trains your body to respond to only that level of pressure and friction. No partner can replicate that. Not a vagina, not a mouth, not a hand. So guess what happens? You start needing more and more intensity just to feel aroused. And over time, it can mess with your ability to enjoy or even complete real sex. I've had patients in their 20s come in saying, "Doc, I can get hard on my own, but not with a partner." 9 times out of 10, it's not psychological. It's training. They've wired their brain and body to associate pleasure with one very specific sensation, and real life doesn't match. So here's what to do instead. Use lube. It reduces friction, prevents irritation, and makes the experience more like partnered sex. Loosen your grip. Let it be more about sensation, less about pressure. Change positions. Try different rhythms. Let it be exploratory, not mechanical. And most importantly, don't rush. If you're treating it like a secret mission to be completed in under 2 minutes with military precision, slow down. Pleasure isn't a race. Fellas, be honest. Did anyone ever explain this to you growing up? Probably not. But that's why we're here. Masturbation is normal. It's healthy, but done wrong, it can backfire. So be nice to yourself. Literally. 8. Smoking kills your erections. Let's not sugarcoat this. Smoking wrecks your erections. Full stop. Every time you light up, you're not just messing with your lungs, you're narrowing your blood vessels. That includes the tiny, super sensitive arteries in your penis. And guess what happens when blood can't flow properly? Yeah, nothing good. Erectile function depends on healthy blood flow. You need strong, flexible vessels to fill the chambers and keep things firm. But smoking? It causes chronic inflammation and hardens the arteries, literally choking off your blood supply. It's one of the top preventable causes of ED. I've seen guys in their 30s come in with performance issues. They're healthy otherwise, work out, eat okay, but they smoke a pack a day. Blood tests? Fine. Testosterone? Decent. Ultrasound of the penis? Major blood flow restriction. And if you think vaping is the safer option, not so fast. Early research shows nicotine, no matter how you inhale it, still damages blood vessels. So if you've been looking for a reason to quit, here it is. Do it for your D, for your partner, for your confidence, for your future sex life. And hey, if you've tried to quit before and it didn't stick, that's normal. Talk to your doc. There are medications, therapies, support groups, even apps that can help you beat the cravings. You deserve a body that works. All of it. And giving up smoking is one of the biggest wins you can give yourself. 9. Chill out. Seriously. Stress is one of the most underrated erection killers out there. And I'm not just talking about the big stuff, divorce, job loss, major illness. I'm talking about the everyday grind, deadlines, bills, kids, scrolling through your inbox at midnight. That kind of chronic stress messes with your whole system. It increases cortisol, your body's fight or flight hormone, and over time, that tanks your testosterone, messes with your sleep, raises inflammation, and yes, wrecks your sex drive. But here's where it really hurts. Stress creates a vicious cycle. You feel anxious, performance suffers, now you're more anxious, and suddenly your brain starts treating sex like a test you're afraid to fail. I've seen this over and over. A guy has one off night, maybe couldn't stay hard, maybe came too fast, and the next time he's with his partner, that memory hijacks the moment. He's not thinking about pleasure, he's thinking, please don't happen again. And that kills the vibe. Again and again. Here's the truth. Not every erection has to be perfect. You are not a machine. Some days will be better than others. That's normal. So be kind to yourself. Cut yourself some slack. Build habits that manage stress. Lift heavy things, move your body, get sunlight, breathe deeply, talk to someone. And when things go sideways in the bedroom, laugh, hug, reset. Intimacy isn't about flawless performance. It's about connection. And the more pressure you take off yourself, the better you'll feel and perform. 10. Use it or lose it. Yeah, you've probably heard that phrase before. But when it comes to your penis, it's not a myth, it's biology. Your penis needs regular blood flow to stay healthy. That means regular erections, whether from sex, solo time, or just your natural nighttime would. These aren't just a sign that things are working, they're how your body keeps them working. Here's what's happening behind the scenes. When you get an erection, oxygen-rich blood floods the erectile tissue. That oxygen helps nourish the tissue, maintain elasticity, and keep the blood vessels open and functional. But if that blood flow stops, if you go weeks or months without a solid erection, those tissues can start to atrophy. Scar tissue can form. The penis can actually lose length and girth over time. That's right, shrinkage. And not the Seinfeld pool kind. I mean actual, structural changes that are hard, sometimes impossible, to reverse. I've had patients who stopped having sex or erections for months due to illness, depression, relationship stress, and when they came back, things just weren't the same. It wasn't psychological. It was physical. The tissues had stiffened, lost elasticity, blood flow had dropped, and now we had to play catch up. So what can you do? Keep the system in motion. That might mean sex. It might mean masturbation. It might mean checking in with your doctor if you notice your spontaneous erections, especially morning ones, starting to fade. And here's a tip. If you're not getting nighttime erections anymore, that's a major sign something could be off hormonally or vascularly. Don't ignore it. Your penis isn't just for pleasure. It's a high-maintenance, blood flow-dependent piece of equipment. So use it or risk losing what makes it work. Bottom line, your penis is not just for fun, it's a barometer of your health. Treat it like you treat your favorite tools. Keep it clean, well-maintained, and use it regularly. And if this helped or made you laugh or reminded you to stop doing something dumb, hit like and subscribe. It tells YouTube I'm not wasting my time here. Want to go deeper? Check out more videos on the channel. Whether you're dealing with low energy, struggling with erections, or just want to stay sharp as you age, you've already taken the first step. Keep going. Your future self is going to be glad you did.